Do you know that good health and well-being is really hot lately?
Yes, I have seen a lot on social media. So what is it?
So let's go ask the experts.
Healthy and what is well-being really like? Because good health is not limited to not being sick, having a good medical personnel. There is a hospital close to home or have a free medical benefits as most of society understands. Health is defined by the World Health Organization. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease of infirmity, which is considered to cover important dimensions of human life, including physical, mental, and social issues. Well-being has no universal definition. It is a word that has a positive meaning in the way people live in society may be understood and called in other words, well-being. This is in line with Thailand's effort to reform the health system that good health must be considered linked to physical, mental, social, and intellectual health, not limited to physical health or illness. Therefore, the development of people health by considering social determinants of health.
Oh, and what side does it have?
Till, have you ever wondered why we need to forget on antibiotic resistance?
Yes, I have. Why do we have to give importance to antibiotic resistance?
That is, today we have experts to answer the questions that we wonder.
Antibiotic resistance when germs develop the ability to defeat the drugs designed to kill them is a top threat to the public health and priority across the globe. In the US alone, it caused more than 2 million infections and 23,000 deaths per year worldwide. Antibiotic resistance threatens our progress in healthcare, food production, and ultimately life expectancy.
But I have one question.
What are you wondering about?
I wonder about antibiotic resistance around the world. How are they solving the problem?
So let's go to listen the experts.
Through CDC antibiotic resistance solutions initiative, the agency collaborates with countries throughout the world to improve antibiotic use, track resistance, and implement infection prevention and control activity in healthcare settings where antibiotic resistance can emerge and amplify the spread. CDC share expertise and deploy experts to investigate and contain resistance outbreaks and assist other countries as they implement infection prevention and control program and antibiotic stewardship program in healthcare settings, establish or strengthen national tracking system to respond rapidly to outbreaks, identify emerging pathogens and track trends, enhance laboratory capacity to detect and report resistance, develop and implement national action plan to address the threat of antibiotic resistance.
How about in Thailand? What protection is there?
The Ministry of Public Health Thailand has the policy to tackle drug resistance by requiring all hospitals to use antibiotic appropriately and has the following tactics. 1. Let all hospitals purchase qualified medicines and with the amount of each drug as need to treat the patient. 2. Establish a system of care and support for the rational use of antibiotics. 3. Strict and effective hospital surveillance and infection control. 4. Improve efficiency in microbiology laboratory testing and monitor the sensitivity of drug resistance to a standard. 5. Ask for cooperation in all provinces to speed up campaign to educate people about the correct use of antibiotics by patient receiving antibiotics from hospital and always take the full amount of medication prescribed by your doctor. And the last one is attribute an antimicrobial resistance surveillance center at Department of Medicine Science, which is supported by the World Health Organization.
And around the world, where are these countries that study this?
I think it's in Vietnam, our neighbor countries.
Yeah, in Vietnam, the CDC partner like the Ministry of Health and local experts are working to establish a national surveillance system which provides structure to track antibiotic resistance, guide prevention strategy, and report results at a local and global levels. The system is currently implemented in 60 laboratories across Vietnam and allows the country to detect resistant bacteria where they can be further spread. Vietnam has made fighting antibiotic resistance a national priority.
The aging population is the most important trend in the 21st century. Such conditions are important and effective. It has greatly impacted all aspects of society around the world. People celebrate birthdays that turn 60 years old at 2 people per second, a total of almost 58 million per year. People with 1 in 9 of the world's population aged 60 and over are likely to increase to 1 in 5 by 2050. The aging population is becoming a phenomenon that cannot be ignored longer.
Will the world in the future have so many elderly people? And you, Emma, do you know how in the future those elderly people will live?
I don't know, but today we have two experts to give an answer to you.
Okay, investing in the pension system is one of the most important methods in ensuring that the elderly can be self-reliant through the economy and reduce poverty in the elderly. The sustainability of this system is a particular concern, especially in developing countries. Social protection based or social protection law therefore need to be implemented as a guarantee of income stability and access to essential health and social service for all seniors.
So how does the elderly need to have access to quality health in order to be good for the elderly?
Today, seniors want the best service and the easiest to you to take care of yourself, whether it's health, financial management, housing, including equipment and technology that will come to meet the need of making life more comfortable and easier, such as using application in smartphone that can do many things such as take care of health, food, or disease. This is especially useful for the elderly. Do you know the true meaning of sustainable health?
Sustainable health is regular exercise.
It's not just exercise. Let's listen to the experts.
Sustainable health is the personal commitment to maintaining and taking responsibility for your own health through preventative curative means. This means not only having regular exercise and taking care of what we eat, but also maintaining a health and balanced state of mind. Ultimately, the only thing we can control is our state of mind and the toxins we put into it to what we eat. If you take responsibility of your own health through preventative means, then ultimately you don't place a burden on the people you love, such as your family, relatives, and society in general. So sustainable health is the preventive approach, a balance of mind, body, and spirit, taking care of what we put into our bodies, taking natural medicine to maintain your health, and hopefully preventing illness before they take shape. Leading and maintaining a balanced life by taking a middle road approach, not too little, not too much is the key. sustainable health principle. Your health is fundamentally directly related to your mental condition and toxins we put into our bodies through what we eat, drink, and breathe. The 10 principles of sustainable health. 1. Maintain a balanced life, middle road approach. 2. Have a healthy diet. 3. Exercise regularly. 4. Sleep well. 5. Maintain a regular rhythm in life. 6. Take preventative natural medicine to maintain health. 7. Engage in spiritual practice manifested through meditation, mind training, and raising personal consciousness. 8. Learn to live and love more. 9. Building discipline in ourselves through mind training and raising awareness. 10. Take a similar approach to life. The result of this will reduce your stress level and the impact of stress upon your health and body. It also has a balanced life. A balanced life means being in control of all aspects of our lives, such as physical, mental, spiritual, family, financial, work and career, social. And it also means not to live in excess because we become attached to them. When we become attached to them, we lose empowerment and they take over and control us. Point in example is TV, drugs, and gambling.
Do the expert have any conclusion or that is easy to understand?
Yes, the summary is we need to rethink the way we handle our health as the current approach is failing us. The current way is expensive, ineffective, and most often only benefit health insurer, pharmaceutical companies, and their shareholders. While we're doing this, we challenge the boundaries of our life through better knowledge and improved approach toward living and maintaining our well-being, not only for ourselves, but for our family, friends, and all our loved ones. And also add development for the public as well. Supports research, development of vaccines and drugs for communicable and non-communicable diseases that directly affect developing countries, provide access to affordable medicines and vaccines. Increase the use of money related to health and the recruitment, development, training, and retention of the health workforce in developing countries, empowering all countries, especially in developing countries, regarding advance notice, risk reduction, and the management of the health risks at the national and global level.
Wow, thank you very much for the experts that provides knowledge on health and sustainable development.
Yes, and there is a summary for easy in understanding.
We have reached the last point. Do you know what the future of public health will be like?
So let's listen to the expert.
Do you know the pyramid? Today I will compare the pyramid with the future of public health to understand and see more picture. The pyramid has a broad base and a narrow top to show the matters near the base have an impact on the health of the population higher than those near the narrow peak. The first 3 stories are health, education, treatment, and immunization. The repeat site and the service provider near the top of the pyramid show that it affects the health of the population is not much to other areas that are close to the base are creating conducive environment for health, behavior, and solving social and economic problems. Affecting health is a story that doesn't seem to concern us much, but rather near the base of the pyramid, it means that it has a high impact on the health of the population. The global economic crisis and the evolution of public health and the incidence of disaster in Thailand, the global economic situation has deteriorated accordingly. One day each recent economic report shows that as many as 100,000 people worldwide are losing their jobs in less than 2 weeks. Without jobs, they would not be able to find nutritious food. In addition, public health budgets are also limited. These are therefore considered important traction force for public health reforms, such as expanding and improving primary care in the private region. But in a situation where the world economy collapse like there, this pursuing cutting-edge technology by ignoring the foundation needs of the population is fraught with the risk of failure. In Thailand, the 30-baht cure of all diseases in the public health reform plan is an important advance. In this study, the researcher raises important issue for analysis. These issues are: 1. Development of medical personnel to drive toward a primary health care system. At present, there is a still huge shortage of personnel working. 2. The habit of Thailand parents to receive public health service in large hospitals, including the freedom to choose to receive treatment with specialist doctor in where feel that they are satisfied with. 3. Confidence in primary health care service that need to be reinforced. 4. The 30-baht program to cure all diseases may need to be modified to add new options for service received and service provided. It is also important to spread awareness about the charging mortality trend of Thai people. Facing disaster are another concern because in the project 30 baht can cure all disease, but patients with cystic disorder need to be examined by a general practitioner before being transported to a psychiatric hospital for future treatment. The problem that follows is most of the drug is primary health care system today are the same drug that were used 30 years ago. So 40% of general practitioners said they had to check more than 40 patients a day, leaving not enough time to treat. Thank you very much. I would like to remind you that, however, there are still many challenging issues that need to be continued and more intensely accelerated, especially in contexts where future disasters are caused by degraded and toxic environment, being poor health due to the deteriorating global economic situation, the inequality resulting from politics and national development during the rapid transformation of the digital age.